Medicare was created in 1965 and plays a vital role in ensuring health and retirement security of older Americans and people with disabilities in current and future generations. Medicare covers persons age 65 and older regardless of their income or medical history, and now covers 47 million Americans, helping individuals pay for needed health care services. Nearly half of all people on Medicare, 47%, live on incomes below $21,600 as individuals and $29,140 for couples. According to the most recent data available, Medicare beneficiaries spent a median of $3,103 a year of their own money on health care in 2006. 10% of beneficiaries, more than 4 million people, spent more than $8,300 a year. The oldest and poorest beneficiaries spent about 1/4 of their incomes on health care. As you know, AARP supported the Affordable Care Act last year because it will improve and strengthen Medicare and provide Americans who currently lack health insurance access to affordable, comprehensive health insurance. President Obama recently suggested that the Independent Payment Advisory Board, IPAB, established under the new law be expanded. AARP agrees with many of the Independent Payment Advisory Board's original goals, that being extending Medicare solvency, slowing cost growth, and improving quality without reducing benefits or increasing cost sharing for people in Medicare. However, we remain concerned about the spending targets the IPAB must meet in its second 10 years and the unintended impact these savings targets might have on beneficiaries' access to or quality of care. We have strong concerns with expanding the role of this unelected, unaccountable board. We will carefully monitor how these proposals move forward to ensure that Medicare is protected and strengthened for the millions of people who depend on it. Other proposals being considered in Congress that would greatly expand the cost sharing on beneficiaries, significantly increasing the out-of-pocket costs for Medicare. We do not believe the answer is to simply shift costs onto Medicare beneficiaries and increase the health and economic insecurity of millions of Americans. Increasing the out-of-pocket costs for people on Medicare would especially penalize the sick. The House passed fiscal year 2012 budget resolution. Before it left for recess, the House passed this resolution, which, among other things, would eliminate the current Medicare program for those turning 65 in the year 2022 and after, and replace it with a defined contribution premium support program, with the government's contribution growing each year by the rate of inflation. We find the direction of this House-passed budget disturbing and in some cases misguided. First, we're concerned that a premium support system would dramatically increase costs for Medicare beneficiaries while removing the promise of secure health coverage, a guarantee that future seniors have contributed to through a lifetime of hard work. Under this proposal, premium payments to private plans would be sharply reduced, capped at levels well below medical inflation. Therefore, Medicare beneficiaries would bear a larger and larger share of the high cost of medical inflation. According to the calculations based on the Congressional Budget Office analysis, the House-passed budget would more than double the beneficiary costs in 2022 from about $5,500 to $12,500, an increase of roughly $7,000 per year in beneficiary premiums and co-insurance. The legislation would also increase the age of Medicare eligibility from 65 to 67 by 2033. Those who enter Medicare before 2022 would continue under the current program with the option to switch to the new program. AARP opposes raising the age of eligibility for the Medicare program because, according to research, it would increase the cost burden for 65 to 66-year-olds, increase premiums and cost sharing for Medicare enrollees, raise costs for states, employers, and for people under 67 purchasing coverage, and produce relatively little in savings to the federal government. And the House-passed budget repeals key improvements in the Affordable Care Act. The two I'd like to speak to today are closure of the coverage gap or donut hole in Medicare Part D and eliminating the Community Living Assistance Services and Supports class program. AARP 4 to close the donut hole because it provides millions of seniors with access to lower out-of-pocket costs for their prescription drugs. Repealing the donut hole provision would immediately increase the prescription drug costs for nearly 4 million Medicare beneficiaries. The CLASS program is a national voluntary insurance program to help individuals pay for some of the costs of services and supports to help them live in their homes and communities. It has the potential to provide savings in Medicaid, support family caregivers in their caregiving roles, and help to give eligible consumers choice and control, and a flexible benefit to help them meet their needs. Abandoning relief from the donut hole and taking away an option to help people live in their homes does not bode well for older adults. The added burden of higher health costs will put more seniors at risk, especially those who are most vulnerable.